Fully vaccinated travelers coming to Grenada will no longer have to submit to COVID-19 testing on arrival, unless displaying symptoms of the virus. This was announced by Chief Medical Officer Sean Charles at the government's press briefing on Wednesday.
We have taken the decision to discontinue the routine testing that we do for persons after they arrive at the airport. Of course, health screening continues. And if someone is screened and the public health officer at ports of entry suspects for any reason that that person may be infected or potentially be carrying a disease, that person will be subjected to test. So the testing now becomes targeted.
Dr. Charles says the decision was made after data showed that less than 1% of the visitors coming through the Maurice Bishop International Airport are tested positive for COVID-19. He further explained that the resources used at the airport will be more effective in the community where most of the positive cases are found.
Now, we have been doing testing at ports of entry. We've done in excess of 6,600 PCR and many more antigen tests. And we have detected far less than 1% of positive cases entering the country. Now, we believe that it is wise for us to use those resources where they are needed most. And since the disease is spreading actively in our community, we need to prioritize.
When asked if the removal of the routine testing will leave room for further cracks in the system, especially when it comes to identifying positive asymptomatic travelers, the chief medical officer had this response.
No system is perfect. No system is perfect. And yes, your observation is correct. It means that an asymptomatic person may come in. All right? Even with testing, an asymptomatic person can come in because it depends on the stage of infection that we are at. But what we want persons to understand is that the infection is spreading from person to person in the community. This is where the disease is spreading, and this is where the Ministry of Health wants to focus its resources.
All other protocols for vaccinated and unvaccinated travelers remain the same. Meanwhile, Grenada is among 22 nations added to the U.S. Centers for Disease Control and Prevention Level 4 category, which is considered a very high risk for COVID-19. Grenada was previously at Level 2, which is considered moderate risk for COVID-19, but was moved due to its recent increase in active cases. The CDC places a destination at Level 4 when more than 500 cases per 100,000 residents are registered in the past 28 days. The CDC advises travelers to avoid traveling to Level 4 countries. Grenada's COVID-19 dashboard as of Tuesday shows a total of 3,346 active cases. Cherry and Blackman Stephen, GBN News.